earFold is quite a revolutionary treatment in the correction of prominent ears. The earFold procedure involves inserting a very small metal alloy implant which has a preset position, and that metal implant remains in place and retains that position, so it's a permanent fix to the ear.
The recovery is more rapid. We use just a local anesthetic. People can resume their normal activities much sooner, and there's minimal risk.
I heard about earFold when I was investigating what ways around having your ears pinned back there are.
It's very different to the traditional technique, which often puts patients off because it involves a general anesthetic. The traditional technique also involves maybe heavy bandaging and dressings that need to be worn for a number of weeks after surgery. Patients are not intimidated by it. They find that it's something they can realistically see themselves going through and returning to work within a day or two after the surgery without a major impact on their life.
The process begins with the patient's inquiry. From there, I would invite them to come and meet Mr. Edward Ball for a consultation.
The patient is encouraged to take a couple of weeks to think about things, and if they're ready to proceed, the procedure can take place as soon as 2 weeks after that initial consultation.
The patient journey's been brilliant, a nice welcome when you get to reception. You go into a nice room with nice views. It's been lovely, really.
The thing that makes earFold really stand out is that it's reliable because they can try it on for size before the procedure, and this is really quite unique. And to be able to actually see what their ear will look like after the procedure is really quite an advantage to the patient.
I've just had my first ear done and it's going fine so far, so I'm looking forward to seeing the results. The process was really good overall. It was quick and relatively painless. I didn't feel anything after the anaesthetic had gone in, so that was obviously nice, and it was enjoyable actually. Everyone around you makes you feel really comfortable, and as well as Mr. Ball, and then it's over before you know it. Definitely do it again. I'd recommend it to anyone.
There are three main reasons that patients come to me looking for the earFold procedure. Firstly, we consider it to be a minor procedure. Secondly, it's a very reliable procedure. And thirdly, it's extremely safe.
The most rewarding part of my job is that I'm part of a team that can create results that some patients have dreamed of for sometimes a lifetime. That's most certainly the most rewarding part for me.